Okay, so I'm going to start by taking the vital signs of the newborn. I already took the blood pressure and I got 65/30. And now I'm going to go ahead and take the pulse for a full minute. Okay, and I got 140, which is between the normal limits of 110 and 160 beats per minute. And next I'm going to do respirations for a full minute. I'm going to look from the side. Okay, and I got 45 breaths per minute, which is also within the normal limits. When the baby cries, it is strong and lusty. So the cry has a moderate tone and pitch. They usually vary in length from 3 to 7 minutes after a stimulus. The temperature on the newborn was 98 degrees Fahrenheit, which is also within the normal limits. The weight of the baby was 8 pounds and 8 ounces. And I'm going to go ahead and measure the length of the newborn. And it was around 50 centimeters, which is also within the normal limits. The posture of the baby is flexed, and the hands are tightly clenched, and the neck appears to be short. The skin color of the baby is consistent with the ethnic background. It is also pink tinged. The texture is smooth, soft, and flexible, and I'm going to go ahead and get the skin turgor by pinching this out of the stomach, and it did return. The hands and feet are not peeling, but it would be normal if they are. The pigmentation is clear, and there is milia across the bridge of the nose and the forehead, or it could be on the chin as well. I'm going to go ahead and assess the skin or the head circumference. And it is within 32 to 37 centimeters. It is usually 2 centimeters greater than the chest circumference, and the head is 1/4 the size of the body. I'm going to go ahead and palpate the fontanelles. The anterior fontanelle is diamond shaped and it is flat, and the posterior fontanelle is triangular shaped, and there could be a slight pulsation. There is moderate bulging with crying or when the baby is passing stool, and the pulsations go along with the heartbeat. The hair texture is smooth with fine texture variations, and there is hair over the scalp and high over the eyebrows. The face is symmetric and it has movement of all facial features. There's a normal hairline, and eyebrows and eyelashes are present on this baby. The eyes and ears are at the same level, and you can tell by drawing a line from the corner of the eye to the top of the ear. The nostrils are equal size, the cheeks are full, and the sucking pads are present. The lips are equal on both sides of the midline as well. The chin recedes when compared to other bones of the face, and the baby makes facial grimaces. The face is symmetric when resting and when crying. The eyes are bright and clear. The eyes have even placement, and there is slight nystagmus. The eyes do move in all directions, and they are blue-gray. The eyelids are positioned above the pupils, but within iris. There's no drooping present on this baby. The blink reflex in response to light stimulus is present. and the eyes open wide in dimly lighted rooms. There are no lumps or redness as well. The cornea is clear, and the cornea reflex is present. The sclera is white on this baby, and the pupils are equal in size. They're round and react to light by accommodation. The vision of this baby is 2200, and it tracks moving objects to the midline. Babies prefer faces, geometric shapes, and black and white in reference to colors. The eyelashes are present, and the cry is usually tearless in babies. The nose sometimes is flattened and is just a result of the birth process. It is small and narrow in midline and is even placed in relationship to the eyes and mouth. It is patent bilaterally, and you can test by having the baby suck on your finger and then close each nostril and see if it continues to breathe. And if it does have trouble, it will stop sucking or make a movement. It responds to odors as well. The mouth, the function of facial, hypoglossal, and vagus nerves. There is symmetry of movement and strength. The gag reflex, swallowing, is coordinated with the sucking reflexes. Adequate saliva in this baby, and the soft and hard palate is able to be felt. The hard palate dome shaped in the uvula midline with symmetric movement of the soft palate. The palate is intact and sucks when it is stimulated. There could be epithelial pearls that appear on the mucosa, but there are none in this baby. The esophagus is also patent, and there's some drooling that can be common. The tongue is free moving, and it is in all directions in the middle of the mouth, and it is usually pink colored and smooth to the texture. The tongue is also proportional to the mouth. Next, we're going to go to the ears. They do not have lesions, cysts, or nodules. The eustachian tubes are cleared with the first cry of the baby. There's absence of all risk factors, and it does attend to sound, which sudden or loud noises elicits Moro's reflex. The neck is short, straight, and creased with skin folds. The posterior neck lacks loose extra folds of skin, and the clavicles are straight and intact. The Moro reflex is elicitable, and there are symmetric shoulders. The chest circumference is about 32.5 centimeters. It is wider than it is long. The normal shape is without depressed or prominent sternum, and the sternum is 8 centimeters long. There is bilateral expansion, but there's no intercostal, subcostal, or subclavicular retractions. And I'm going to go ahead and listen to the breath sounds of this baby. And it is important to listen bilaterally so that you can compare the breath sounds. The chest and axilla are clear on crying, and the bronchial sounds bilaterally, and you can hear the air entry, which is clear. The cough reflex is absent at birth, and then the breasts are flat with symmetrical nipples, and the breast tissue is about 5 centimeters. And between the nipples is 8 centimeters. I'm going to go ahead and listen to the heart sounds now. The rhythm and rate was regular, and there are functional murmurs but no thrills. There is a horizontal groove at the diaphragm which shows flaring of the ribcage to mild degree. Next is the abdomen. It is cylindric with some protrusions, and it appears large in relation to the pelvis. There is no cyanosis on this baby, and few vessels are seen. The umbilicus has no protrusions, and it is a bluish white color. The cutis navel and granulation tissue is present in the navel. There are 2 arteries and 1 vein apparent, which is normal. And there is no bleeding in this baby. I'm going to go ahead and listen to the bowel sounds. So soft bowel sounds are heard shortly after birth, and it is important to listen for about 10 to 30 seconds. The femoral pulses are palpable and they're equally bilateral. And there's no bulging along the inguinal area, and there are no inguinal lymph nodes felt. And I'm going to percuss the bladder. Okay, and the urine has mild odor, and the baby is expected to urinate, if not at birth, a few hours after. Next, we are going to assess the genitals. If it is a male, the penis is slender in appearance. It's about 2.5 centimeters long and 1 centimeter wide. It has a normal urinary orifice and urethral meatus at the tip of the penis. It is non-inflamed urethral opening, and the foreskin adheres to the glands. Uncircumcised foreskin is tight for about 2 to 3 months, and erectile tissue is present. In the scrotum, loose skin, and it hangs or it is tight and small. It is extensive rugae and normal size and normal skin color. And the testes are descended by birth, and they are about 1.5 to 2 centimeters. If it is a female, it is normal skin color, or it could be pigmented in darker skinned infants. The labia majora covers the labia minora, and it is symmetric size appropriate for the gestational age. The clitoris is normally large in newborns because of edema and bruising in breech birth. The urinary meatus and vaginal orifice is visible, and there could be discharge, and that is usually due to the mother's hormones from birth. I'm going to go ahead and flip the baby over to assess the buttocks and anus, and to make sure that the buttocks is symmetric. The anus is patent, and there is passage of meconium within 24 to 48 hours after birth. And there were no fissures, tears, or skin tags present on this baby. So the extremities are short and they are normally flexed. The extremities move symmetric through the range of motion, but lack full extension. All joints move spontaneously, and there is good muscle, and they are flexed. The arms are equal in length, and they move bilaterally as well, and they're typically flexed when quiet. The hands are have a normal size, and they have the appropriate number of fingers, which is 5 on each in the palms. The nails are present, and they extend beyond the fingertips in the newborns. The spine is C-shaped, and it is flat and straight when the baby is prone. It is easily flexed and intact when palpable. At least half the back has languo on it, and the back is straight. The hips, there is no sign of instability, and the hips adduct to more than 60 degrees. The legs are equal in length, and the legs are shorter than the arms at birth in the newborns. The feet are in a straight line, and fat pads and creases are on the soles of the feet. For motor function, it is symmetric movement and strength in all extremities. The babies might be jerky and have brief twitches. That is normal. The head leg not over 45 degrees, and the neck control is adequate to maintain the head of the baby.